So for my son, the words disappeared at 24 months. So
he had the words
he had
and then
the
they
words,
vanished.
yeah.
Oh.
And then again, because I think I was concentrating so much on my daughter, I didn't notice so much about Ephraim. There is sensory overload. At that time, you don't know. You don't know about sensory. What is sensory? So there's sensory overload. There's lights, there are smells, there are sounds. They are unable to regulate themselves. So they used to scream a lot when
So
they
the
were
sensory
young.
overload,
Yes.
does it mean they are hypersensitive to light, to sound, or
Yeah.
what does that mean? Okay, now I'm curious. We've talked about you seemed to really inform yourself, educate yourself, put yourself in a place where you must give your children everything that they need to be able to journey through this process. But I'm asking, is there now a point where you began to focus on Wambui and said, I need to take care of Wambui? And when is that? Or when was that? Yes.
Well, maybe right now I've started going out with friends. We started going out with my husband for dates. Now they are in a good place. They're independent. I think that's what I was looking for.
Yes.
They're independent. If you leave them
Where
at home,
they are not entirely relying on
they are
you.
not. Right now they're not relying on me on anything. They come from school. If I'm not at home, they open the door. They just go make their snack. They do their homework. They go. Yeah, they don't need me right now. Yeah.
How old did you say they are now?
Nema is 12, Ephraim is 10.
Okay.
Yeah, I tell you, I push them. So they are even dishes. I don't find dishes in the sink. They wash the dishes, and they are okay.
Oh wow!
They are, so yeah. So now I think that this is what I was looking for. Now I'm able to, go out and not call after every 2 seconds. I don't even call. Even if when I call Nema tells Mom, Mom, you're disturbing me. Why are you calling me? We are okay. So yeah. I think
So
now.
do you leave them with an older person?
No,
or they are by themselves?
no, just by themselves.
You can leave the two of them.
Yeah, and the baby. Nema is able to take care of the little sister. Yeah, there's a time I don't know where I went. I had gone. I called the school. I told them, don't let my kids go home. I'm on my way. So when they were going home, Nema was told by the teacher, don't go home, Mom is not at home. Nema told them, no, I have the keys for the gate, I'm going home. She took her siblings and they went home. She didn't have keys. Yeah, I told you, I was wrong to pray for like.
Oh, she didn't have them?
She didn't have keys. I don't know
And
how.
she told the teacher she has
Yes.
Okay.
I don't know how she opened that gate.
Wow.
But she did open that gate. Yes. And then they were just in the compound because the main door was locked. Yeah, and so I'm going to the school and I'm asking, where are my kids? I think they went home. Oh my God, I almost died. Because I'm thinking they had to cross a road. That road is very, very busy. Yeah. And Emma was just holding them. Not Ephraim, the baby sister Hope. And they went home. And they're okay.
So there's a point where you said she wasn't conscious of danger or
yes,
something like
yes,
Is she
yes,
aware
yes.
now?
Yeah,
Like
she's aware.
maybe...
Oh my God,
Okay.
she's aware of everything. She's aware of danger. She's aware of everything. Okay. She's aware of everything. If you're not a good person, she's able to tell. Yeah, she's aware of everything. She can do everything right now. Even Ephraim, both of them.
Wow.
Yeah.
Question, Wambui. I've heard about, you talked about the sensory awareness and stuff like that.
Yes.
And there's a school of thought that says that people who suffer with that disorder do not like to be touched. Yeah. How true is that? So some of them you actually like, you're coming like to, like say, hi Eva, and they actually,
Yes. It's called tactile. Tactile is still it's still a sensory. So Ephraim, when he was young, he had tactile issues. Even the clothes, you will put on some clothes. I think Nema used to. I was not aware about tactile, so I think that's the reason why she used to remove her clothes because of those labels. You know the labels that we have at the back of the clothes. Yes, they were irritated. Yes, okay. But Ephraim, I think his sensory with tactile was heightened because he wouldn't let you hug him. He wouldn't let anyone touch him. But right now, he's able to regulate. I think as they grow up, they are able to regulate. So there are kids who are like that, and there are those who want to be hugged and to be held all the time. Actually, most parents, they're called weighted blankets. So when he's sleeping, that
Feels like someone is holding him.
Yes, and weighted jackets also. Yeah, there are those one who just won't touch. There are those who don't want to touch them at all. Yes.
Let me ask you, as a parent that is raising 2 children with autism, what would you say should be the attitude and the approach from a parent to such children? In terms of as a parent who's raising 2 children, another parent that has got a child that is suffering the same disorder, because I'm sure there are lessons that you've learned along the way. How do I approach them? How do I deal with them? Do I show them there's something wrong with them? Do I love on exactly what are some of the, apart from teaching skills, what is the right posture and attitude? And maybe you can look at this camera and just address the viewers at home and tell them, what have you learned? What are some of the lessons? What are some of the take-homes? Because probably there's somebody watching us and they are thinking, wow, I don't know what to do with my child. And from what you're saying, it looks like it has something to do also with the parent's posture and attitude towards that child.
Before I answer that, let me just say something else. Yes. Most parents with kids with autism, you find if your autistic child is the firstborn, you don't want to have another child. You don't, because the experience it's so draining. I first encourage parents. You are not God, and it's God who gave you that child. You are not God; it's God who gave you that child. Please go ahead and have another child. For me, when I realized I was pregnant with my last child, Hope, Ephraim, I think, was 7 years old, and you are still going through those emotions of you are potty training. You don't not potty training. You are teaching skills, and you are still having sleeping problems. And also, let me just say that their drug, their medication you can use. If your child really can't sleep at all, and you have tried everything, you have tried diet, you have tried, making them tired during the day, and still they're not sleeping, I think your doctor can prescribe there's some medication. But I really pray that God, that I'll not use any medication with my children. So when I realized I was pregnant with Hope, it was, of course, it was God who gave us Hope. It wasn't planned, because what are the chances? You have 2 children with who are on the spectrum, and then I was heading I was on my late 30s, as in, it's like autism. Of course, when you give birth at that age, chances of getting a child with autism are very high, especially if you have other children. Yes. So, I was so afraid. I can't even lie that I wasn't afraid. I was so afraid. But Hope came, and she's so neurotypical. So I encourage and I want also to say that the neurotypical children, the ones who are not autistic, neurotypical ones, they really help.
Also, so the ones who don't have that.
Yes, neurotypical, yes.
Right.
Typical. They really help the autistic children. Because my son, my firstborn, he's not autistic. He doesn't even realize their siblings are. I don't think he notices they are autistic, because he plays with them. Right now he doesn't. I was asking him before I came for the interview, what do you want? I said, I don't notice, because at home they do the same chores. They're doing everything the same. But when they were younger, I think he would notice it's only that he has forgotten. So the neurotypical ones, they really help to raise the autistic ones. They help with speech, with play, because I told you, an autistic child, you have to teach everything. You also have to teach how to play. They can't teach them how to play. So my firstborn really played a very big role with teaching the siblings to play. And Hope right now, because I told Ephraim, you have to prompt him to talk. So now Ephraim loves Hope so much. So now Hope talks a lot. And Ephraim now
feels... That's your last one?
Yes. Ephraim now feels the need to respond to Hope. So now Hope is able to make Ephraim now talk a lot. Yeah. So I encourage parents out there, don't stop at that one child or 2 kids. If you are able to have another child, go ahead. It will work out. Now to your question.
Yes. I'm still waiting for the attitude, the right attitude and posture.
I realize when you're given the diagnosis, I saw another parent commenting, when you're given the diagnosis of autistic child, it's like your dream of the child that you have dreamed you'll have. Your dream is dead. Your dream, crushed. Yes, it goes with. And I tell parents, it's not about you. What I've come to experience right now, it's not about you. It's about that child. Imagine the way him to navigate those senses. Maybe he's hearing voices you can't hear. You are able to regulate noises. Right now, if somebody hammering outside, you'll be able to regulate yourself and you not hear the hammering. But a child with autism is able to hear the hammering. He's able to hear the birds. He's able to hear the cars. You see, his hand.
It's not selective hearing. Yeah.
And that's what makes them block their ears a lot. You find them blocking their ears. Yes. Yeah, you'll find them making funny noise to try and regulate themselves. You'll find them steaming. Steaming is when they're like flapping their hands or they are rocking like this. That's the way of trying to regulate their sensory overload.
Because he's feeling things, but he doesn't know how to express.
Yes, and that's why I tell parents, if you find your child steaming, like flapping or they're just rocking, don't stop that. Because most of the time you stop that because in the society everybody's looking at their child. Hey, what's wrong with this child? So as a parent, you're very aware of what is going on and try to stop that. Don't try to stop that. So when you get the diagnosis, first is that steaming. You have to be aware of steaming. Don't stop steaming. Let them steam. Unless they're not, so long as they're not hurting themselves. There are those who bang their heads. So that one you have to stop it. You have to find a way to stop it. And when your child is having a meltdown, if my child, Neema is the one who used to have meltdowns when she was younger, I was able to be calm. Teach yourself how to be calm and to be patient with your child with autism, because patience, you need patience. So be able to regulate yourself as a parent. You are the parent now. So if your child is having a meltdown, they are overloaded. Just sit down. Sit down. It doesn't matter if it's in a supermarket. I've ever sat down in a supermarket with my daughter. You sit down, you hold her, and everyone is looking at you thinking you are spoiling this child. Don't worry what people are thinking. Focus on your child. Just hold that child until they calm down. And then what I tell parents, just be very calm. Calm, don't panic. I think we panic a lot. And then I tell parents, you are not the one who is experiencing this. It's this child who is experiencing this. It's not you. And you are the parent. Try to put yourself in their shoes. Try that. And then be calm. Calmness is first thing. Be patient and ask for help. There are so many places to ask for help right now. There are so many places you can ask for help. What I didn't do, I didn't ask for help myself. So I was experiencing burnout a lot when they were younger. Caregivers, they experience that. Don't go to that. Don't go up to that level. Even if you're at home and your child is too much, they are banging themselves, they are breaking things, and you're unable to handle that, go to the toilet. Just come out to your bedroom, just close the door, put music or do whatever. But don't react. That's a word, don't react. Because you're going to beat that child. Don't react at all. So, and sometimes it's so overwhelming. Just take a walk. Those are things that I never used to do. I used to deal with those things there, and I think I wasn't very good with that. I wasn't very good with dealing with that time. I didn't know what I know right now. So take a walk, But most importantly, don't sit down. I know resources is very, very. It's a whole new issue with autism. If you don't have money, there are many parents who don't have those resources. There are free services. Kise, it's 100 for therapists. They have all kinds of therapists in Kise. APDK, at some point, they were offering free services. I think
what is
APDK? APDK is around Westlands. I I forget the name. I forget the name of something.
Something
about
with people with disabilities.
in Kenya.
Association.
Yes.
Of people living with disability.
Yes, something like that.
Okay.
APDK, they were offering that for free. You also need to get your child registered with the National Council of People Living with Disabilities. It will help you a lot. They give stipends, they give money for school fees.
Oh, really?
Yes, you just fill the form. You're helped that way. You also give money to parents. There are forms we used to fill. If you want to start a salon, they buy everything for you. You start a salon. Yeah.
But somebody has to come and prove that it's true.
You
have a child with
yeah,
disabilities.
you have to go there and be registered with them. There's a registration. Right now, they're doing it online, so it's easy.
Okay.
Yeah. So just ask for details. You register your child. You can be paid for school fees. You can get that. There's a lot. I have a friend of mine, a neighbor whose child was needed surgery, and that surgery was costing around 156,000, and that card paid everything.
Oh, wow.
Yeah. So it's good to register them. Always ask for help. Always ask for support. If you feel overwhelmed, please ask for support. Look for support group. I realize there's also the issue of stigma. So sometimes finding...
I was going to go there.
Yes.
Good you raised it.
Finding support sometimes is very, very hard. Finding somebody who can walk with you that journey is very hard. Right now we have so many social support groups. We have schools which are very, very welcoming to our kids. Yes. And as a parent, you have to create space. Like now where my kids go to school, you know, because schools is just another issue. Kids with autism, if you go to our groups, everybody, you see somebody whose child is in PP2 and they have gone to 10 schools. They are rejected because your child is all over. You know, he's pinching others, So it's an issue. There are those people who will just take your child and then they will be locking your child somewhere. They will not get any activity done. They will not get any academic work done. They're nothing.
And you're thinking your child is in school.
You are thinking your child in
That
school.
is so sad.
Yeah,
That
because
is bad.
you're taking your child to school so that they can get social interaction. And then if the teachers and the administration, they're not able to teach the other kids how to work with kids with disability. You know, even the neurotypicals, they're just kids. You teach them how to work with these ones. So what I tell, because that's an issue. Every time you'll find parents saying, "Oh my God, I was told not to go back to school. Where do I start?" That's the headmaster wrote me a letter, told me don't bring a child back to school. And there's nothing you can do. If you go to the Ministry of Education, they will tell you, if it's a private school, it's a willing buyer. Yes. So, but if it's a public school, no, that one they can intervene. Yeah. But you see now with public school, it's a whole different issue. So I tell parents, be proactive. Like where my kids go to school right now, we've created a program where we are taking our children for therapy. To Kise, they are able to do. We bring people to talk to we train teachers. We talk to the teachers. The administration is very. If you are as a parent, you are active. Even you are encouraging the teacher to be able to work with your child. But if you just go and just leave your child there, there's nothing you are doing with the child.
The teacher has no idea what to
do. The teacher doesn't know how to do. The child is not potty trained. They want the teacher to potty train the child. You're not potty training at home. I tell parents to also be active. Because if you do early intervention, autism, everything about autism is early intervention. If you start early, at the age of 2-3 years old, by the time they are 10, 11, most of them, you'll find that they are manageable. You know, most of them they are very sharp. They just need of course they learn differently. They will not follow blackboard and chalk in this system. You lose them. But if you start teaching them the way, like using pictures, using having an individual program with them, they are very, very bright kids. Very bright. Yeah. So the parent you have to be active. Proactive. So you have to be proactive. Yeah. And I tell parents of course, also when you get the diagnosis, sometimes the shock, there's grieving, there's denial, there's anger. it's okay to go through those processes, but don't stay there. Yeah, don't stay there, because that child is depending on you. You are the parent. You have to know, just find resources. Wherever you are, I don't care if you are in whichever county, there are resources. You know, and right now, because of social media, we have WhatsApp groups. We have many WhatsApp groups, you know. Yeah, just go and ask questions.
Even on Facebook, I believe there
Even
are
on
groups that people
Facebook,
can
yeah.
join
Yes, they are
and
there.
get information.
Yes, a lot of information. Yeah, don't rely on Google. Google will kill you.
I
All
like
right,
something that Wambui you have said.
Yeah.
I'm looking at what you have gone through and the kind of information that you're able to come and share with us and share with the audience. And I'm thinking of this scripture that says that we comfort others with the comfort that we
have
ourselves
received.
have received from the Lord.